$35 a month for their insulin supply and so on. Well, here's some facts behind that. First of all, on that point, it was already the case, even before the mandate was put in by the Biden administration, because the Trump administration had already put it in, but everyone forgets that. But more importantly, the private sector had already solved the problem for the most part. Most private health insurance, even before Trump or Biden decided to try to impose mandates, was $35 a month or less. That's my family. We've enjoyed that because we have good private health insurance that already gives you that. There is a second thing to think about with insulin, and why is it that after it's a century now since insulin was invented or discovered, why is it on patent at all, right? Shouldn't it be completely off patent after a century? Normally a patent's about 20 years. Well, what happens is, and this is a fluke or a quirk of our patent laws, is they change the dosage.
Americans are capable of achieving extraordinary things when they have the freedom and opportunity to do so. This is American Potential. And here's your host, Jeff Crank.
Hello and welcome to the American Potential Podcast. I'm Heather Andrews, your guest host for today's episode, and the Western State Regional Director for Americans for Prosperity. Let me ask you this. Have you ever had to make a tough decision between paying for medicine or covering another essential bill? If so, you're not alone. Rising healthcare costs are creating real-life trade-offs for people, and it's a critical issue that impacts us all, whether we realize it or not. So what's really behind these skyrocketing healthcare costs? Is it the weight of decades-old regulations, government subsidies, and mandates driving up prices? Or are healthcare providers simply responding to their own rising costs? Maybe it's a mix of both. Either way, the end result is clear. Insurance companies and government agencies are shrinking options, and it's patients who are left paying the price, literally, with fewer choices for their care. But what if there was a different approach? One where patients are empowered to take charge of their healthcare decisions, along with the freedom to control their options in healthcare dollars. Today, we're diving into the heart of this healthcare crisis to better understand what's driving these costs, and more importantly, what can be done to fix it. I want to welcome back Dean Clancy, who is a Senior Policy Fellow at Americans for Prosperity. Dean, healthcare policy can feel like a maze to a lot of people. It's complex and often overwhelming, but you've dedicated your career to studying it and figuring it all out. So what sparked your passion for diving into such a challenging topic, and how did you become a leading voice in this field?
Well, it's really great to be here, Heather. I really enjoy this podcast, and it's fantastic, and so it's an honor. I got into healthcare almost by accident. Back in 1993, I was a fresh-faced new legislative aide to a congressman on Capitol Hill, and right after I got hired, they said, "Hey, do you want to cover the healthcare issue for us? There's this thing called Hillary Care coming down the pike, and nobody in the office wants to deal with it." So I said, "Okay, sure." And I'm still doing health policy 30 years later, and it's great. I mean, it's a mess. That's why we're talking about it. But there's always hope.
Yeah, agreed. So essentially, you started by having to figure out like Obamacare, Hillary Care, and
right.
that crazy bill that was,
That's right. Hillary Care was the Obamacare before Obamacare, and it was defeat. And we defeated it. This was Hillary Clinton. We defeated that. Obviously, it was Republicans and Democrats who defeated it back in 1994.
Okay.
And then the ideas came back in a slightly different form in 2009 as Obamacare. And that time it did become law, barely, and over complete and total Republican opposition. And 10 years later, or 15 years later, it's created a mess.
Yeah. Would you say that is something that is contributing to the rising costs of healthcare, or what would you say is the main driver of these rising costs?
There's many drivers, but Obamacare, which the official title is the Affordable Care Act, is a major contributor to the rising cost of health care. Just to give you a data point on this, next year, employer-provided health insurance premiums are going to go up 9%. Okay, that's going to hit working families all over this country, and that follows an 8% increase this year and a 7% increase the year before. You can kind of see the pattern here. Cumulatively, health insurance prices have gone up 25% under President Biden. And there's no sign of it ending. And a lot of it is because the government in the so-called Affordable Care Act drove up the price, created incentives for insurance companies to maximize their prices. They make more money that way. The taxpayer subsidies they get are based on how much they charge. Charge a higher price, you get more money from the taxpayers. What a deal. And the result is exactly what you think it would be. All of us are paying more for our health care every single year.
So you're saying essentially, when I go into the doctor, if I were to go to the doctor's office and had a procedure done, whatever, they have contracted, like I guess they've contracted, my provider has, with the insurance company for what the insurance company is going to pay towards those costs.
Mm-hmm.
And then
right.
And they're incentivized, is what you're saying, to bill the insurance company at a higher price.
No, I'm saying that the insurance company is incentivized to charge the highest possible premium. And by the way, to pay the doctors and hospitals as little as possible, and to deny claims, to find excuses and play games to not actually pay for coverage. Some of that was true before Obamacare, but Obamacare intensified all those perverse incentives, and the federal tax subsidies that low-income individuals get for buying so-called Obamacare health plans, those are percent of premium subsidies. So if the premium's higher, they get a bigger subsidy. That money goes straight from the U.S. Treasury to a health insurance company. And what you, the patient, get is, well, you hope some health care trickles down to you. And one of the results of this whole system is that it's getting harder to find a doctor who will take your insurance. They call it provider network shrinkage. Basically, the insurance companies, again, because of these incentives, are having fewer doctors and hospitals in their network. So when you take your Obamacare health card, and this is affecting everybody, not just Obamacare, they may not take it. They may say, well, we don't take that insurance. So it's a real problem. We need to deal with it.
Right. And, I know in my state that I live in, and a lot of other areas, actually, I've seen hospital systems that are, not only providers, but like hospital systems are consolidating, creating near monopolies. So what impact does that have on patient costs, and how can competition be restored there?
A number of government policies. You'll find a theme here. It's a lot of what's wrong in American healthcare, what's broken, is due to government policy. By the way, there's a lot that's good about American healthcare. We haven't completely socialized the system. There are still pockets of choice and competition, and markets do work in some ways in some areas. In general, however, the majority of American healthcare has been effectively socialized. Government regulations, subsidies, taxes, mandates, price controls are all distorting the markets, and it's a problem. Competition is a huge problem. You mentioned, like hospitals, you only have one hospital-based corporation in your area, so they charge outrageous prices. This is happening all over the country. The Federal Trade Commission says that 90% of American healthcare markets are highly concentrated. There's really not effective competition. And what policies are driving that? Well, for example, Medicare, that's the insurance program for elderly and disabled Americans, pays an inpatient hospital 2 or 3 times as much as it pays, say, a doctor's office or an outpatient facility for exactly the same service. And the result is these hospital corporations are going around buying up all the doctor's offices and the outpatient facilities, bringing them under their umbrella. So now you slap the hospital's name on the door of the doctor's office. Now they charge 2 and 3 times as much. It's still a doctor's office. They're still doing the exact same thing. They're just charging twice as much. And that's government policy at work right there. So that's why at AFP, we really want to promote what we call site neutral payment. So if it's, same service, same price, doesn't, let you choose whether you want to get your surgery at the big inpatient hospital or a specialized ambulatory surgery center, or maybe even in your doctor's office. It should be up to you, the consumer, and not the playing field shouldn't be tilted by government policy.
Right. Makes sense. And yeah, it sounds like a sound policy that could potentially drive costs down. Well, that's great. Talk to me about, so telemedicine, that has basically surged during the pandemic. And a lot of states kind of went to, those emergency powers where they allowed a lot more opportunities for telemedicine to be provided because of what happened under COVID. How can telehealth and like other solutions like that continue to evolve to drive down costs while also maintaining quality of care? And should states and should the federal government be involved in that? Should it just be a state issue? What are your thoughts there?
Well, telehealth is just one example of areas where just by removing government barriers, we can make healthcare a lot more convenient, hassle-free, safer. With telehealth, there's less chance of infection because you're not actually you're not in a doctor's office or a hospital where infections tend to accumulate. And in fact, we did a study on this at AFP during the pandemic, and we found that emergency room visits in Medicare went down because more people were using telehealth, but it didn't seem to have a negative effect on health outcomes. It also saved taxpayer money. You can pay less for a telehealth visit because you don't need as much overhead and so on. It's great for doctors. It's great for patients. But unfortunately, after the pandemic subsided, a lot of these temporary relaxations of the restrictions on it went away. And so we're back kind of to where we started. But the difference is most Americans now have had a taste of it. And they realize that this really is what healthcare should be like. And I'm not just talking about like a Zoom call with your doctor. It could be remote monitoring where there's a device monitoring your heart rhythm or your blood sugar, and it is collecting the data, and it, mutually agreed between you and your doctor, could be reporting it in real time. The doctor could get an alert. You've got a heart rhythm problem. Why don't you, go to the emergency room or what have you? It can save lives. And why are there any restrictions on this at all? Well, it's because insurance companies, and I'm classifying Medicare, Medicaid, Obamacare as essentially big insurance companies, they see it as a cost. It's outside their sort of control a bit, and they're afraid it'll be abused, that it's too easy, and they like to throw up barriers to people getting care because then that increases their profits. Or in the case of the bureaucracy, it shrinks the bottom line to deny care. So we have to change the laws so that these programs will cover this. Now, it should be optional for private sector insurance companies and patients and doctors. For government programs, I think it should be a standard benefit because it's just better health care. And that's just one example, Heather. There's a whole bunch, like why shouldn't you be able to use wearable medical devices, which can give you lots of information and share the information and plug into your doctors and your insurance. There are barriers that make that difficult. The certificate of need laws. These are these protectionist barriers that states use to try to prevent new hospitals from opening, new facilities, new birthing centers, or even expanding them. You have to get a government permission slip, and often the process has a thumb on the scale in favor of the existing competitors. They actually are on the board that decides whether you get to compete. It's like you want to set up a pizza shop and you have to go before a board that consists of Pizza Hut, Papa John's, Domino's. And, surprise, surprise, they say, we don't really need any more pizza places in this area. And that's certificate of need. We need to repeal those laws. And we've actually been doing that and having a pretty good success rate, thankfully.
Yeah, that's great. That is great. And then another thing that's coming down the pipeline, you kind of touched on this a little bit earlier, but the Tax Cut and Jobs Act is set to expire, the TCJA. And in it, there were some things that were related to healthcare. So can you tell those that are listening and those are not aware, because I just, you hear the title and you just think it has to do with taxes. And for a lot of people, taxes will obviously go up if those provisions expire. But to, many people's surprise, I'm sure they weren't expecting to have healthcare part of that whole deal. So can you explain what exactly will be affected and then what Congress should be looking at doing?
Yeah, the Tax Cut and Jobs Act of 2017, very good bill by any sort of objective standard. It made our tax code more efficient, actually made it more progressive, simplified it, cut tax rates on businesses and households. It helped the economy, and it's still in place. But the individual tax cuts, things like increasing the standard deduction and lowering the tax brackets and things that really affect households, those go away at the end of 2025, and Congress will need to step in to keep them going. And at AFP, we are working very hard to make sure that happens, and we also want to prevent Congress, while they're doing that, from, say, increasing tax rates, a so-called wealth tax, or increasing the corporate tax, or so on. We need to be competitive, so we need a low corporate tax rate. And that bill did a great job on that front. It actually helped our exports and the economy. Anyway, hidden in the bill are things like green energy subsidies, and to pay for the hundreds of billions of dollars worth. And a lot of this is just scams and money wasted. They haven't built a single, electric vehicle refueling station yet, despite sending billions of dollars out the door. And how do they pay for it? Well, one of the ways was they imposed government price controls on drugs in Medicare. They've patted themselves on the back on this. They think it's a big accomplishment. They took on, pharma, the big drug companies, and they negotiated and saved money. It turns out what they actually did was they imposed price controls, because that's what the provision really does. It's not a negotiation. There's a huge tax on your entire business if you don't agree to whatever the government dictates. So it's a Godfather style negotiation. And but the funny thing is, they're not even good negotiators. They came out with the first set of negotiated prices, and they're almost the same as the current prices. I don't know what they were thinking, but boy, they're very proud of themselves. Anyway, that money is supposed to save money, and it's supposed to go to pay for the Green New Deal stuff. And then on top of all that, they massively expanded Obamacare. Those subsidies we were talking about earlier, they increased them hugely, and but they did it temporarily. Those provisions also expire at the end of 2025. They said, well, this is pandemic relief, although by the time they did this I'm not talking about the Inflation Reduction Act. In fact, I've been talking about it with the green subsidies and the Medicare. Those expire at the end of 2025, and they have caused all kinds of waste and inflation in the healthcare sector. They have caused a doubling of people enrolled in Obamacare, and that's mostly because for the first time now, you can get totally free health insurance on Obamacare. It's not very good health insurance, hard to find a doctor, huge deductible. That's the part you pay out of pocket before your insurance kicks in. But you get this shiny insurance card. Well, 11 million people have signed up because it's absolutely free. They wouldn't take it when it was only so many dollars a month, but when it's free, they take it. And guess what? The Paragon Health Institute found that there's $20 billion a year with a B in fraud. People are claiming lower income than they really have. In some states, more people are claiming that income than exists in the state. In Florida, it's like 4 times as many people as are eligible have signed up for this. So it's a boondoggle. That's part of these big bills, the Inflation Reduction Act, so-called. By the way, inflation hasn't been reduced, as far as I can tell. Anyway, I got off topic. You were asking about tax cuts.
Yeah,
there was a lot of junk in there.
I know. No. So what would you say, kind of to follow up with that, like what should Congress be looking at doing? Because obviously, if these do expire, it's going to raise costs. like you mentioned. So how easy, I mean, obviously we don't know how November is going to turn out, but what should they be looking at doing? What should is there anything they should let expire? Are there things that they should do to continue on the process?
Have you got an hour? We can talk about.
Oh my gosh. Maybe I know, right?
I'll give you the top lines. First of all, renew the good tax cuts from 2017. Second, don't raise taxes. Third, repeal those Medicare price controls, which are funding the Green New Deal stuff, and more importantly, are actually going to drive up healthcare costs long term and stifle innovation. The research drug companies have been shutting down whole lines of research on promising new pharmaceutical therapies because they can't be sure they can recoup their investment, their research costs.
Right.
And it's because of those price controls. So get rid of those and allow these massive Obamacare expansions that Biden pushed through to expire at the end of 2025. That will end all that fraud that I was talking about. It will reduce the inflationary pressures on health insurance, although healthcare is still going to cost a lot because of Obamacare and government mandates. So that's just the basics.
Yeah.
And then beyond that, we need to actually reform healthcare.
Yeah.
And the good news is we can do it in an incremental, bipartisan way. It doesn't have to be controversial. Healthcare is very polarized politically, especially at the federal level. It doesn't have to be. There's a number of good things we can do to make healthcare more affordable, more accessible, more hassle-free. And Congress should prioritize that. They should get that done. And, here at AFP, we call these ideas a personal option. Let's give Americans a personal option in healthcare.
Right. And so, that sounds like a more of a free market solution to create more competition, and which naturally would lower prices. Do you have any examples of where this has worked before? And then also, can you explain, for those that don't know what personal option means, can you explain a little bit about what that is?
Sure. Let's start with personal option. It means you, the patient, should have the choice of your health plan, your doctor, how much you want to insure against. Everybody needs health insurance for the most part, but why should you have to buy all the bells and whistles that some politician or bureaucrat insists that you have because they think they know best? Why not buy what you think is right for your family? Why can't we trust patients to make good decisions for themselves? The personal option also means specifically letting everybody save and pay for healthcare tax-free. That's something we allow in a very limited way today, and a few million Americans benefit from that. Why not let everybody do that? That reduces your out-of-pocket costs for healthcare. It also gives you an incentive to be a more savvy shopper. Speaking too fast. And when you do that, that tends to bring prices down. You start asking, hey, how much is this going to cost? Which doesn't go on very much in healthcare right now. There's no price transparency in American healthcare.
Right.
You never hear a price. You never see a price. You get a surprise bill later and you think, wow, that's a really big price.
Absolutely.
And it's because of all these government rules, mandates, and incentives. So another thing is to make sure everybody has direct access to doctors. They don't have to use their insurance to go to the doctor. And there's a great new way to do that. It's called direct primary care, where you just pay a monthly subscription every month, a one low fee, no extra fees or hidden charges. And you get basically unlimited access to your favorite doctors. It's like a Netflix subscription. And people love it. It's affordable and it's just better healthcare. Doctors and patients both do better with direct primary care, but there are barriers and we need to remove those. And you were asking, so that's the personal option in a very, sort of high level way. But you also asked about something else, which I'm now completely spacing on.
Do you have examples of where this may have been tried or tested or worked? And yeah, I do. I love the idea of the direct primary care model. I think that's amazing. I think a lot of people, for me at least, my company pays, or I get to choose, here's the options that are available for you to be covered, and I can choose. And actually, I wanted to ask you about this in a little bit, but this last year, I was like, I'm going to try an HSA. Never done that before. I'm going to try it. And I absolutely, so I've been paying a lot less than my, for my premium, but my HSA has been just phenomenal and allowing me more options and choices. And so going back though, like, do you have examples where this may have worked and where, because I know a lot of Americans, they don't even understand. I mean, I think they fall into the same category as me, where you just have here's your options from your employer, or if you're self-employed, here's what options you have able to provide healthcare for your family, which a lot of times is way more unaffordable than, So help us travel that a little bit.
Lot going on there, and great questions. Let's start with what works.
Yes.
Whenever you let markets work in healthcare, things are really great. And we have very good real world examples of this. I can think of 3 off the top of my head. One is LASIK laser eye surgery. When I was younger, that was very expensive, and there were worries about the quality, the safety. Now it's incredibly affordable, and the quality is excellent. And why is that? Well, because insurance doesn't pay for it. Government health programs don't pay for it. You pay out of pocket with your own money. So what happens? You double check the quality. You look for the lowest price. You shop around. And by the way, you could use your HSA money, which is tax advantage dollars, to do this. So LASIK is an example. Cosmetic surgery is another area where there is no insurance involvement, and it tends to be very high quality, and prices are always falling. And then the third example is generic drugs. The U.S. actually beats the whole world on the affordability of most prescription drugs. Now, this is hard to believe because we think of drugs as being very expensive and as, the big pharma companies are evil and all that. And maybe they are a little evil, but, they're just trying to make a buck like the rest of us. But guess what? Back in the 80s, Congress surprisingly passed a really smart law, and they basically encouraged competition in prescription drugs. And this is what we call generics, which are you could call them copycat drugs, right? You have an initial drug it takes billions of dollars and years to develop. It's a breakthrough. It does great things, but they got to recoup their costs. And the U.S. government guarantees them a patent, which is a temporary monopoly on the sales of that drug. So yes, it does cost a lot at first, but Congress tried to make sure that competition, that patent ends as soon as possible, the competition comes in as quickly as possible. And guess what happens? When you get one competitor, the price falls by half. You get 4 competitors, the price falls by 90%. And so we're seeing this in drug after drug. Yes, expensive at first, but eventually very affordable. And so 90% of all the money that Americans spend on prescription drugs is for generic drugs. It's only 10% is for the expensive brand name drugs. This is much better than any other country. It's because we decided to have good laws on this. We still have to fix some things. The drug companies still play games and try to deny competition, delay competition. I mean, they're not angels, but we can fix those problems. We shouldn't have government price controls on them or confiscate their patents, which is what some folks on the left, like Bernie Sanders and even Joe Biden, have proposed to do. No, let's not kill the goose that lays the golden egg.
Right.
Let's just make sure that there can be competition on a level playing field as quickly as possible. So those were 3 examples of what really works in healthcare.
Yeah.
And I think you also started asking about the complexity of healthcare and the choices.
I was actually like moving on to the health savings account stuff because I'm such a huge proponent after, I just had never tried it. And I thought, well, why should I? I have 4 kids. I was a single mom for a long time. And I just know my kids are very accident prone and have to go into the doctor quite a bit. For my son played football, so he was constantly getting concussions. And my daughter's a snowboarder, and she used to fall quite a bit and have issues. So I thought the best thing to do was have, the higher premium was going to take care of more expenses, and I'm not going to have to pay a lot more out of pocket. But it turns out HSAs are actually like wonderful. And I still have my kids on my plan, and the HSA has turned out to save me quite a bit of money out of
That's
pocket
great.
and everything. And I love the flexibility as well. Like, so what percentage right now of Americans have access to a health savings account, and how would you explain what it does?
Well, first of all, I just want to congratulate you on joining the happy minority of Americans who have discovered this powerful financial tool. HSAs are wonderful. It's a tax break on every medical purchase, can be 10%, 38%, and your money goes farther for your health care. It's for out-of-pocket expenses, not for insurance, but it's for out-of-pocket expenses. You do have to have insurance to have an HSA. And but it turns out only about 10% of Americans, as a practical matter, can have one. So you're in the lucky minority, Heather, you and I. But the reason for that is because when Congress wrote this requirement that you got to have health insurance before you can have an HSA, they also decided to tell you exactly what kind of insurance. It has to have a certain deductible, has to have a certain maximum out-of-pocket limit, typical government kind of regulate micromanagement. And so as a result, most people just don't have access to that particular kind of health insurance. Most employers don't offer that particular kind of health insurance. There's not really a market for it. It was designed by politicians rather than by entrepreneurs. And, most Obamacare plans are not HSA qualified. So the result is, on paper, a lot of people have access, but in reality, only about 1 in 10 of us has access.
And how hard would it be to make HSAs available to like every American or anyone who wanted it?
It would be rather easy. And we've been working hard to do this. How do you do it? Well, you could just get rid of that requirement that you have health insurance to have an HSA. Right. That doesn't seem to sell on Capitol Hill, where we're trying to persuade members of Congress. I think they're afraid that people will try to just get by on their health savings account and not, and just go without health insurance. I don't think that would happen, but I understand the concern. So what you can do is you can ease or relax the definition of what qualifies as HSA qualified coverage. There's been many bills introduced to do this. There's a new one. Blake Moore from Utah, your state.
Wow.
Congressman Blake Moore put in a great bill. It's called the HOPE Act. HOPE is in all capital letters. And what it would do is it would say any standard form of health insurance is HSA qualified. It could be Medicare, Medicaid, Obamacare, employer-provided coverage of any kind. It does have to, cover a certain amount of your costs. Can't be super skinny. But basically, it's every kind of insurance that virtually all Americans rely on today. So that would be fantastic. By the way, he has persuaded Democrats to co-sponsor that bill. In the past, HSAs have kind of been partisan, with Republicans in favor and Democrats skeptical. But this bill has an equal number of Republicans and Democrats supporting it so far. So we're very excited about the HOPE Act and the idea of HSAs for all.
Yeah. That would be huge. That would be great. And then, in your opinion, are there any other solutions that Congress should be looking at when it comes to trying to lower the cost of healthcare?
Oh, my goodness. This is another one that it takes an hour, but highlights. First of all, let's have more prescription drug competition. Let's accelerate how the Food and Drug Administration approves drugs. There are drugs that are approved in Europe and sometimes for years, and they're not allowed in the United States because the FDA just hasn't gotten around to approving them. And why hasn't it? Because it requires the same safety and efficacy studies that the Europeans have already completed and found the drug is safe and effective. No, FDA insists on doing it itself, so they reinvent the wheel. And the way they do it is very expensive and time-consuming. So Americans either have to try to go and get those therapies from abroad, or they have to suffer. And that's ridiculous. So we support legislation that would just say, if it's approved by countries we trust, like the European Union, as safe and effective, it's automatically approved in the United States.
Right.
Kind of a common sense idea.
Right.
Another thing is make sure it's easier for biologicals. This is like insulin, for example, is a biological therapy. Make it easier for them, for for the lookalike versions, the generic competitors, make it quicker for them to get to market by basically saying, by not requiring excessive studies. That's another area where the FDA has these studies that the Europeans have said, you don't even need those studies. They're called switching studies, to make sure it's exactly the same biological agent. And you just don't need them. And yet we're still requiring them. So those are two examples in drugs. And then there's plenty of other things.
And with insulin,
go ahead.
Well, like insulin, the reason why it's just been so expensive is because there's not as many generic options, right, as some other drugs are. There's not as many FDA approved options for insulin, which has completely driven up the cost. Whereas others, when there's competition and you see other generic options that have been approved, like you said, it drives the cost down.
Right.
I always hear that as an argument for a lot of people, how it's one of those, the people that hate the pharmaceutical companies and everyone thinks that it's them that's creating the whole, they're evil. Insulin is so expensive for everyone, and it should be because, these people have to have it to
that's right. I have a son with type 1 diabetes. I mean, he takes 5 shots a day.
Right.
It's life or death for us. Couple of points on insulin. I'm so glad you mentioned it because it's been very prominent in political discussions of healthcare. There's this whole thing of we got to make sure nobody gets charged more than $35 a month for their insulin supply and so on. Well, here's some facts behind that. First of all, on that point, it was already the case even before the mandate was put in by the Biden administration, because the Trump administration had already put it in, but everyone forgets that. Yeah. But more importantly, the private sector had already solved the problem for the most part. Most private health insurance, even before Trump or Biden decided to try to impose mandates, was $35 a month or less. That's my family. We've enjoyed that because we have good private health insurance that already gives you that. There is a second thing to think about with insulin. And why is it that after it's a century now since insulin was invented or discovered, why is it on patent at all, right? Shouldn't it be completely off patent after a century? Normally a patent's about 20 years. Well, what happens is, and this is a fluke or a quirk of our patent laws, is they change the dosage. They get a new patent. They change the delivery system, a new injection device or something. They get a new patent. And then the drug companies also play games where they come up with the new version and then they stop selling the one that's going to go off patent. So that way they're prolonging their patents through game playing. We need to fix those problems. Just because you change the color of the pill doesn't mean you should get a monopoly.
Right. And sorry, I cut you off on you were going through the drug options, and then I think you were going to go into something else with what Congress should do to try to lower costs of healthcare. Sorry, did you? That's
just drugs. Drugs are only 10% of all American healthcare costs. So 90% is hospitals and doctors. We mentioned some of the things we can do for hospitals, like site neutral payment, repealing certificate of need laws. On physicians, we could allow and should allow, and some states now are starting to do this, allow internationally trained physicians to come to the U.S. and practice here. That will help address the physicians shortage, which in some parts of this country is quite severe. And that will lower costs and improve options. I mean, some of these international doctors, they come over here and they drive Uber. They work at a pizza joint because they cannot practice medicine here. Why? Because they're forced to go and complete all the same training, residency, and tests that they've already done overseas. They've been practicing medicine overseas. They have to start completely over in the U.S. Why not, streamline their path into the workforce since they're already trained? And AFP is working in a number of states to get laws passed that basically expedite the licensure of those international graduates.
That's so great. Yeah, I met a gentleman not too long ago who was one of those. He'd been practicing as a heart transplant, actually doing heart transplants in another country for 30 years, and was taking another. He moved to America and had taken another job. Doing something very different, and he was very frustrated. But he was leading efforts. He was very much trying to become a solution or helping become the solution to the problem by sharing his story and encouraging legislators to come alongside of him with helping change the laws around that so that we can have those individuals. I mean, 30 years is like a long time. You don't have, a lot of people or a record of, issues, then I don't see any reason why these individuals don't deserve to practice in the United States and why we shouldn't welcome them with open arms here. So
absolutely.
Yeah.
And by the way, it seems to me not one of the reform ideas that we've talked about should be controversial or partisan.
Right.
I mean, I think they're all common sense. With some of them, it's just special interests. The drug companies will fight you on patent reforms. The hospitals will fight you on site neutral payment and certificate of need because they got a gravy train going and they don't want to lose it. But for the rest of us, that's not compelling. We need freedom, choice, options, competition. Markets work in healthcare when you let them.
Yes. Well, thank you so much, Dean, with unraveling some of the mystery and all of the things the intricacies of healthcare policy. I appreciate you being with us this evening or today on this episode. Thank you so much. Yeah, we hope to have you back.
Well, it's been a real pleasure. You're a great interviewer and great stories, and it was fun.
Great. Well, liberty and freedom are easily taken for granted. Don't take it for granted. Get out there and defend freedom and liberty. The American Potential podcast is always working on stories to help keep you inspired and informed. And the best way to stay connected is by liking and subscribing to our channel, as well as following us on Facebook, Twitter, and YouTube. And if you know of a great story of someone that's working on expanding freedom and opportunities that we should share, be sure to go to our website, americanpotential.com, and fill out our Share Your Story section. Thanks for being with us, and remember, your voice and your actions matter and make a difference.
Thank you for listening to American Potential. You may listen to more stories from Americans working every day to expand freedom and opportunity in their communities by visiting AmericanPotential.com.